According to the American Stroke Association, each year about as many Americans have a stroke as they have a heart attack. That's a sobering statistic when you really think about it, but a lot of people don't even know what causes a stroke in the first place or even what we can do to prevent one from happening. Since May is Stroke Awareness Month here, there's no better time really to learn more. Joining me now, Dr. Nirav Shah, the stroke director now of Swedish. Congratulations on that new title. Let's talk about what a stroke is first and foremost.
Thanks for having me, Alex.
Yeah.
A stroke is a time when there's no oxygen suddenly to the brain, either through bleeding or a blood clot. When the brain suffers a sudden loss of oxygen, we call it a stroke.
Yeah, a lot of people think this just affects the elderly. Is that true? Is that just a myth?
It is mostly true. The average age of stroke in the U.S. is about 65. Although recently we've been taking care of more and more young people with stroke. Stroke in the young in Washington State is increasing. In Seattle, we've taken care of many late 20 and early 30-year-olds with the stroke as well.
Why is that? Is there any statistics pointing to why that's happening? It's
a little bit unclear. There are a lot of reasons why that may be happening. It may be that we're getting better at treating and preventing stroke in the elderly or in the adult population. And also there are other things that may be genetics that we haven't identified before or other risk factors. Could be a number of things that we're working on trying to identify.
Okay, let's talk about what we do know. Dr. Shah, tell me about the symptoms and the things that we need to be looking for in each other and then in ourselves, of course, too.
Sure, that's a great question. We talk about the FAST, F-A-S-T, when we think about stroke. F for facial weakness, A for arm weakness, S for speech, slurred speech, or difficulty speaking language or understanding language. And the T is for time, because if you have any of those symptoms, we want you to act fast, call 911, so that we can provide emergent therapies in the hospital.
Any of those individually a cause for concern, or are you looking for like a combination of a couple of those things?
All of those would be cause for concern, but any one of those, without a reason that starts suddenly, should be a reason to call 911 and come see us.
How can those things be prevented? What should we be doing to take care of ourselves?
There are lots of things that we can do. They're the usual things you hear about: diet, lifestyle, exercise. But the things that we focus on specifically to prevent strokes are cholesterol, diabetes, not smoking, and heart issues, and high blood pressure. Working on those with your primary care doctor or with us if needed, then we can help reduce your risk of stroke by 80%.
Okay, is this something that you can go to the doctor for specifically if you feel like, you've got one of those fast symptoms and you need to be seen? Can you go to your general practitioner, or do you need to seek out a specialist?
It's probably advised to go to the ER straight if you have one of those symptoms that I just described. But if you had those symptoms that come and went, it's still worth going to an ER, because that could be a sign that you're going to have a stroke. We call that a TIA, which is sort of like the brain's version of chest pain. It means you're going to have a stroke maybe in the next day or month.
All right, Dr. Shah, thank you so much for being with us this morning. And for more information about Stroke Awareness Month, just head to our website. Lots of information there for you, q13fox.com. Back to you.